WAJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 4 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
And good morning. It is Wellness Wednesday for this 23rd day of December 2015, our final show of the year. It's hard to believe, but our final Wellness Wednesday show of the year. And this morning, we're going to be discussing radiology with Dr. John Leone. He's with us in the studio from Fairmont Regional Medical Center. And Doctor, good morning. Thanks for coming in.
Good morning. It's good to be here.
We've got a broad array of topics to discuss, and we'll go back all the way through the history of what it is you do, radiology and the X-ray technology that dates all the way back to the 1800s, all the way through the new advances, the MRI advances that occurred in the 90s, and the nuclear medicine advances that have occurred just in the last few years. And you've been at this a while, so you've seen the technology advance. Let's start there and just talk about the changes of what you do and how the technology has made it easier.
Okay, I've been at this a while, but I wasn't there when Dr. Rankin discovered X-rays in 1895 in Würzburg, Germany. So believe it or not, before that time, there were no X-rays. So there were no X-rays in the Civil War or those wars that occurred before then. But of course, by the time World War I came around, they had developed X-rays. And the clinical application of X-ray came very quickly after the discovery of X-ray in 1895. So in those early days, they were taking, you can imagine, taking pictures of broken bones to actually see what the fracture looked like. And then pretty early on, they gave people barium to drink and took pictures of their stomachs to detect masses or ulcers. And then the same things for the colon, would put barium in the colon and take the old barium enema, which nobody likes, but it's been supplanted now in modern day medicine by colonoscopy. So that's when X-ray started. Myself, I started in radiology training in 1984 here at the WVU, at the old WVU hospital before it was Ruby. And I graduated in 88, and that's when it became Ruby. And I've been at it ever since with Radiological Physician Associates, which is our group. And we have 20 radiologists here in North Central West Virginia, and we do the majority of the X-rays in the local hospitals. We do Mon General Hospital, Fairmont Regional Medical Center, United Hospital Center in Clarksburg, Davis Memorial in Elkins, and then Preston Memorial, and several other small hospitals throughout the state.
Mm-hmm. You mentioned the Radiological Physician Associates. You're president of that group, and that's local, right? That's right. That group has been intact since the mid-'60s. I joined, like I said, in 88, and I've been president since about 2002. So for the last 13 years. But it's a long-standing presence, a successful group, and been here a long time. What is the benefit of working together and sharing information? Is that group just locally?
Physicians, it's interesting. Physician groups now are becoming less and less popular because a lot of physicians are being now employed by hospitals. We've been able to stay independent, and we like it that way. Hopefully we can continue to do that in the future. It helps, clinically, helps tremendously to work with others because you can show each other's cases and ask questions. And certain people have subspecialties within radiology. You can be a neuroradiologist or a musculoskeletal radiologist and actually do additional training. So those people are very useful as resources for tough cases.
Do you have a particular
I am a
field of expertise?
I'm a general radiologist. I was I was accepted to do a neuroradiology fellowship at the University of Pittsburgh in 1988, but then I was offered this job, so I took the job and forego the fellowship and just doing general radiology, which encompasses many things.
Yeah, but we'll talk about that. Yeah. I mean, there's a broad spectrum in terms of radiology and the services provided.
Right. In addition to the regular X-rays, there are ultrasound, which sort of came around after World War II, was developed as a byproduct of the sonar used to detect the U-boats, the submarines the Germans were using. But anyway, that technology was then applied to medicine. And then computed tomography came in the 70s, where you get using computers combined with X-rays to generate transaxial images, like cutting through the body, where you can get much more detail of the soft tissues of the body. So CT has become an integral part of daily practice. And then MRI, which developed in the mid-'80s and has become pervasive in sports medicine with the injuries, and you can't get through an NFL broadcast without a mention of an MRI, especially with knees and shoulders, and it's very useful in detecting acute soft tissue injuries of the joints. And in addition, mammography, a very popular topic. A lot of women vast majority of women are screened with mammography. There's been some controversy in the news recently by the different health organizations coming out with different recommendations about mammography, when you should start and how often you should have it. But it's definitely been a good screening tool and has increased our ability to detect breast cancer, and I believe increases the survivability of women with breast cancer with early detection.
The ultrasound. Any of us who have had children, our wives are in for the ultrasound, and that's always a big event when you get to see that first image of your child. But there are many more uses for ultrasound, right, in terms of health?
Right, there are. Abdominal imaging with ultrasound is very popular. We do it every day, and the main thing would be evaluation of the gallbladder. So people come in with right upper quadrant pain, and the question is it an ulcer or is it a gallstone? So traditionally you can order two tests. You can order the upper GI exam to detect an ulcer, or you order the ultrasound of the abdomen to evaluate the gallbladder to rule out gallstones. And you can also see, if there's gallbladder wall thickening, indicative of inflammation. You can see if there's obstruction. You can see the bile ducts and see if they are dilated. In a patient with jaundice, a stone sometimes can migrate out of the gallbladder and into the common bile duct and cause a blockage, and the patient would be have painful jaundice, which is indicative of a common duct stone. And then also different masses within the abdomen are detected with ultrasound. You can use it also for evaluation of the abdominal aorta to rule out an aneurysm.
So there's a lot of uses there.
There are.
And you mentioned the MRI. That's primarily, we hear about it constantly, even down to the high school and middle school level, with athletes that suffer injuries or believe they have an injury, go in for an MRI. And you're right, we hear about that pro and college sports. Is that primarily with injuries to knees and elbows and shoulders, or how is that technology used in terms of advancing health?
Well, the musculoskeletal aspect is a big aspect, but also MRI was a major advance in the imaging of the brain and spine. Because before MRI, you really could not visualize the spinal cord itself without putting something else around it. We used to do myelograms, where you'd put a needle into the spinal canal in the thecal sac in the lumbar spine and inject X-ray dye into the sac, and then you would take pictures. So you're basically outlining the spinal cord and nerve roots with this other radiopaque substance so you could see them. But with the MRI, you actually can see that directly. You can see the spinal cord. You can see pathology of the spinal cord. In a patient with multiple sclerosis, you can see white matter plaques within the spinal cord and also within the brain. MR is a very good, an excellent tool in the evaluation of multiple sclerosis, because MS is a difficult diagnosis. I mean, it's a clinical constellation of symptoms that can come and go, that can wax and wane, and sometimes can be difficult to diagnose, but it has a pretty typical appearance on MR of the brain. So that's very helpful. And also with brain tumors, too, obviously, and stroke. So many diseases that affect the brain are best evaluated with MRI.
And the MRI, I would imagine, with traumatic injuries, you mentioned the spine, automobile accidents, falls, workplace injuries, I would imagine it's helped in terms of diagnosing those and seeing exactly what's going on in there.
It does, but actually with the ER, in trauma cases, CT is more widely used, because you're imaging the bones directly with CT, and you can get the bony detail to rule out any fractures.
We'll talk about the difference there.
Well, it's hard to talk about the difference without talking about a little bit of physics. So I'll try to do this. With CT, we are using ionizing radiation and detectors around the body. So if you've been in a CT, it's like a big donut. So inside that donut, there's an X-ray tube and there's a ring of detectors. And the X-ray tube spins round and round. And the information goes to those detectors and then goes through and is analyzed by the computer to create the image. So basically, you're getting the radiation going through the body into the detector at different intensities because of the tissues that it's passing through. When it passes through bone will absorb more of the X-ray. When it passes through soft tissues, it'll absorb less of the X-ray and more will get through. So you have that contrast difference, and that's what you generate the image for, or that's how the image is generated. So with that, the bones are very well seen, and the soft tissues are well seen because they have different contrast levels. Okay. Now the MRI is the image is generated without ionizing radiation. Okay, so this is almost like a magic trick, MRI, because with an MRI you have a huge magnet. Okay, so that's why you go in there. They won't let you bring your credit cards in. They'll demagnetize them. So you have a huge magnet, and what that magnet does is there are ions in your body that are positive or that are bipolar. They have positive and negative charges, and the most dominant element is water in your body. So water hydrogen is the main component of water, and it has a positive and a negative pole to it. So you get in the magnet, and the magnet will align a percentage of your water ions in a positive or negative field with the magnet. Okay, so you're in the magnet, you have your water, the hydrogen ions aligned, and then you're going to introduce what's called a radio frequency pulse. So that's the noise you hear if you're in the MRI. I forgot to say one thing. The hydrogen atoms, in addition to being aligned, are precessing, which means they rotate. Okay, so they're rotating around. So then we're introducing this radio frequency pulse, and that knocks them down on their rotation. So they rotate in a wider arc. Okay, so then we turn off the pulse, and the hydrogen ion continue to rotate, but they move back to their original rotation. And when they do that, they emit a signal. And that signal is detected by the MRI. And then the computer analyzes those signals and then constructs an image.
It's incredible.
It's unbelievable. A Nobel Prize was won for that, and well-deserved, because of the technology. It's amazing. It really is. That's why it's sort of like a magic trick that you can get that picture out of that.
Magic trick, and we've just had a physics lessons. We'll have a quiz on that when we return, so make sure you stay with us. We're with Dr. John Leone, native of Brooke County, right?
Yes, sir.
Graduate of WVU?
Notre Dame undergrad and then WVU Medical School and
WVU
residency.
Medical School, very good. And again, president of the Radiological Physician Associates right here in Morgantown, West Virginia, and an expert on radiology. We'll take a break. We'll return. There's a movie coming out that everybody seems to be talking about, and there's a connection to WVU with Dr. Julian Bales, former WVU medicine personnel, and he's portrayed in the movie. It's about concussions in the NFL. We'll talk about that a little bit when we return. Stay with us on Wellness Wednesday.
Now back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
We are with Dr. John Leone, radiology specialist, Fairmont Regional Medical Center, working as part of a group, president of the Radiological Physicians Associate, which incorporates Fairmont Regional Medical Center. With us for a few more minutes, and Doctor, the movie Concussion is coming out, and everybody who's a sports fan is kind of looking forward to this. Some a little bit apprehensive, perhaps, as to how the subject matter will be handled, but it's very sensitive. I mean, concussions, the awareness has grown. You were telling me off the air you've worked with the Fairmont senior football team the last decade. Your son played this year, so you know all about this, the heightened awareness concerning head injuries, not only in football, but in all youth sport activity.
Yes, obviously it's a big topic. It's been in the news everywhere, and now with this movie, will be even more talked about. So it's and it's serious. I mean, it's a serious issue, obviously, with football and other sports. But the pendulum swings back and forth with recognition and awareness, and sometimes in the high school game, we're overly aware, which is good. I mean, we're erring on the side of being conservative and catching all the injuries. But and as far as imaging with concussions in high school, it's rarely needed. It's usually a clinical evaluation, and then if there's a serious problem clinically, then some of the children can be imaged, but it's rarely needed.
Well, the problem comes with the repeated concussions, right? That's probably when the imaging comes into play a little bit more.
Right. With the years and years of multiple injuries, and then they have the degeneration in the brain, like with Mike Webster, and But all those type of changes in the brain are very difficult to detect, and actually impossible to detect until the autopsy. So it's we haven't come up with a test that can clinically show brain injury from concussion. In traumatic cases, you can see blood in the brain, or like a car wreck or gunshot injury. You can see blood in the brain or blood around the brain with a subarachnoid hemorrhage or epidural or subdural hematoma. There are things that are seen on the brain, but with concussions, the vast majority of them, if they are imaged, are negative.
Well, you've worked with the trainers, and you've seen the trainers come through, and it seems like each and every year there's more. There's a heightened awareness to it,
and they've standardized it now and have a concussion protocol.
Mm-hmm.
If an athlete comes off after a head-to-head contact, or his contact his head with the turf or whatever. If he has a headache, if he has blurred vision, if he's nauseous, then he's pulled out of the game and evaluated again during that game, and hopefully the symptoms may resolve at that time. But if they don't, then they're followed throughout the week, and if those symptoms don't resolve, they don't return to action until they do.
All right, we got about a minute left. Just kind of talk about what you see the future of radiology. I mean, medical advances, it seems like it changes by the minute, but what you see for your profession here coming up in the next few years?
It is it's a wonderful specialty, and it's very helpful to doctors, throughout in multiple different medical fields. I think the patient demand has sort of driven the need for, or the desire for X-rays, and it may be even more than is medically needed. And doctors talk about this to other doctors, but rarely to patients. If a patient comes into the ER and is expecting to get a CAT scan for a headache, and if they don't get it, they're disappointed. And that's often so the doctor wants to make sure everybody's happy, so he'll get the X-ray.
Right.
Even though so anyway, there's some utilization there, overutilization, but we have the tools, to detect disease, and they're there, and when well utilized, I mean, it's a great advance in medicine.
All right, very good. This was very interesting. We learned a little physics. We learned the history a bit of radiology, and we appreciate your time coming in.
Well, you're very welcome. I enjoyed it too.
Dr. John Leone. He's the president of the Radiological Physician Associates, encompassing Bond General, Fairmont Regional Medical Center, of course, United Hospital, and several other rural facilities as well. And we appreciate his time and the insight and information provided today on Wellness Wednesday. That'll wrap up our show. Thanks for listening. We'll talk to you again in 2016.